Another thing that people always ask about are sagging, jowling, and crepey skin. I know those are all kind of different things. The sagging, the jowling, and crepey skin. How do you approach that, and when is it time for like a surgical intervention?
That's a very, very good question about the surgical intervention. We'll get to that in a second. But how do I approach sagging versus crepey skin? Those are two separate issues. So in my mind, like sagging, I think of sagging versus sinking. Are you somebody who's losing volume completely and you're like sinking in and caving in? You know, or are you somebody who has the volume but you're just dropping?
Yeah.
I'm going to be more of a sagger, right? I have a weaker jawline. I don't have the greatest bony projection and I have volume, so I'm going to drop. But you know those sinkers who have no volume in their face and they start to cave in on their cheeks and their temples. So you look at those two subset of patients and you try to approach them, differently. I don't use fillers to lift, all right? It got overblown, this whole lifting. Like a filler cannot lift. I use fillers to fake optical illusions, to fake proportions in a face. No one is symmetric. Everyone has one side that's wider and one side that's narrower and one side that's higher and one side that's lower. So I use fillers to even out the height of your face on both sides so that you look more cohesive. And when you are a sagger, it's easier to do because you have volume there that you can play with. When you are a sinker, it's harder to do because you need to replenish that volume, unfortunately. And so the filler is doing a little bit double duty work. Or you have to look for things that are like stimulants, like Sculptra, to help give an under padding to a person's face before you could play with that proportion. And so you have to look at the person in front of you and how they're aging and follow their aging process because some sinkers end up holding to filler better than others. So if that person is okay, you can slow it down on them. But there are some who just eat it up like it's water. And so you have to kind of change your way of working with them. So that's how I approach the volume aspect. But crepey skin is more of a textural thing. And it is somewhat related to volume as well. If you don't have any under padding, yes, you can get crepier faster. So if you're a sinker, you can look crepier faster. But crepey skin generally is usually just a textural thing. And so how do you then work on the superficial texture of the skin? A combination of different ways, from using your own blood, PRP, PRF. I think that works great when you're introducing it with trauma. So microneedling and adding that to the microneedling, it makes a bigger difference than just doing it on its own. Retexturizing lasers, I think Fraxel can also be helpful. I am not as big a fan of like ablative lasers like CO2 lasers where you blow your face off literally. Because people are doing it in their 20s and they do not need to be doing it that young because they can start looking waxy fast as they get older. And it's like a weird waxy look to the skin that happens. It's like, you're literally creating these superficial burns, right? So over time, if you do it way too much, it's not going to look right. So I kind of like to keep that for a later stage in life, but not at a younger stage in life. And then even certain fillers, when you dilute them, or you'll have like the skin boosters in Europe, like Profilo or Skin V, which is like the American sort of version, which is not as good as Profilo, but certain skin boosters can really make a difference to kind of create that superficial tautness to the skin. But it's a multidimensional approach. So it's not just a one size fits all. You have to look at the person's face, their structure and everything when you're approaching that. But getting back to the surgical question, I ask every patient who comes in, is plastic surgery in your future? And not because I'm judging, but because I want to know, again, like what is their journey and how am I supposed to pace myself for that person? And so I ask every patient that comes in, and if they're like completely against it, I'm like, just put a note, don't talk about plastic surgery with this patient. Or if they're like open to it, like put a note reminder when I should tell this patient to go start for consultations. Because I tell every patient, a facelift is a great thing if that's something that you want to do, but you're going to have to maintain your face afterwards. And it's not because I do what I do. It's because you're aging the second you walk out of the OR. And so if you're getting a facelift, usually around like 9 months after, you start doing lighter maintenance and you start holding onto your face. And so you can hold on again to the essence of who you are and hopefully not let it go sideways, right? But I think with plastic surgery, the eyes you want to do before you really need it, because you don't want to go from looking extremely tired to all of a sudden looking open and looking like a different human. So you want to kind of hit the eyes slightly before you need it. So it's still your eye shape, your expression, your face. So that's the only one that I really think you should do ahead of time. And then usually when it comes to a facelift, I think doing it in your 30s is wild. I don't know. Like, I look at it as a long-term road, and I'm like, what are we trying to chase here? Unless somebody has a real issue, of course, there are exceptions to the rule. But I usually think like facelifts, lowered face, 47 to 53 is like that like zone where you want to get it in. And I think usually if they go after 60 for their facelifts, like it's going to be okay, but it's harder to achieve that result you're looking for, because once you get the jowls, it's hard. And if you're going to do a facelift and you're going to pull, your mouth is going to look like this, it's not right. So after a certain point, once you lose that elasticity in your skin, you have to be okay with a facelift that's not perfect if you want to look good. So that's why you have to kind of time it correctly with your face as you're aging.
I like small tweaks over time. And I feel like that's the most undetectable way, because as you age, your appearance does change anyway.
Yeah.
So if you're doing these little tweaks, it's not like such a drastic thing, to your point, where all of a sudden you're 60.
And you're like going from this to this.
Yeah. And that's how people get that like windswept, or like the lion face, it's so dramatic.
It's
the
so
wheels have fallen off. It's like trying to put them back on.
1,000%.
But like the raw material is like not maybe as good as it is when you're 47.
Honestly, 1,000%. And when you see like these like plastic surgery before and afters of like a woman who's like clearly in her mid 60s, and then the after looks like the person had a head transplant.
Yeah.
I don't go, wow, like, okay, amazing work.
Yeah.
Like, credit to the physician. Yeah. Absolutely. But from like a mental perspective, I'm like, holy mother, like this person, I don't think that's like for me, that's not what I would want for myself. Mm-hmm. And so I would want to like keep holding onto my face in a slower way. So again, eyes before you fully need it. Light work if you feel like this is dropping, but I wouldn't go from like 0 to 1,000 at like 60, hoping to get everything done once I'm past the stage.
I have a friend who's a plastic surgeon, and he says like there's the conveyor belt of time. You can't get off the conveyor belt, but you can do these things that can like set you back a little bit on that conveyor belt of time, like a facelift, like a eye procedure, brow lift, whatever it is, and you're not trying to stop it. You're just like trying to move a few steps back.